Medical importance of black flies. Black flies have the role as pest as well as vector for the transmission of different pathogens. Biting of black flies causes black fly fever due to reaction to various salivary components from flies. Human disease agents transmitted by black flies is that of onchocerciasis or river blindness caused by Onchocerca volvulus, which is a nematode. This parasite is transmitted to human by the repeated bites of black flies. Please note that onchocerciasis is distributed mostly in tropics of sub-Saharan Africa. It is also exists in two countries, namely Brazil, Venezuela of Latin America, and also in Yemen of Arabian Peninsula. In some countries, the disease has been eliminated or elimination program is going on. It is also noted that more than 90% of infected people live in 31 African countries, and it is the second most common cause of human blindness after trachoma. Moreover, subcutaneous nodule formation, patches of depigmented skin as leopard skin, dry wrinkled skin similar to lizard skin, and loss of elasticity of skin look like elephant knees are also seen in onchocerciasis. Another disease transmitted by black flies is Mansonelosis. It is transmitted by at least 5 species of black flies in Brazil, Colombia, Guyana, Venezuela, and southern Panama, as well as in northwestern Argentina. Mansonelosis also found in Caribbean islands where culicoid species are considered to transmit the causal agent. The disease is now spreading to many other countries of the world. Mansonelosis has less or no pathogenic effect but may cause joint pain, headaches, and pulmonary lesions. However, black flies might have the potential role in transmitting different other diseases as mechanical vector. Some studies demonstrated that the causal agent of tularemia, Eastern equine encephalitis, Venezuelan equine encephalitis virus have been isolated from several species of black flies, suggesting the potential role of these flies in transmission of such pathogens.